For more than 15 years, we've been investigating whether hormone-disrupting chemicals and other contaminants of emerging concern are making their way into Cape Cod drinking water from septic systems and from other sources. On Cape Cod, 85% of residents rely on septic systems, and the soil is pretty sandy, so contaminants can make their way through groundwater, and all Cape residents rely on groundwater as a source of drinking water. So there's concern that there can be contamination from septic systems and other sources into drinking water. In 2010 and 2011, we conducted studies of municipal or public drinking water wells and private wells all throughout Cape Cod. And we found that there were contaminants making their way from household wastewater and making their way into drinking water. These included pharmaceuticals, consumer product chemicals such as non-stick and stain-resistant product ingredients, and an artificial sweetener. What we learned was that wells located in more densely developed areas, the ones that are more likely to be impacted by septic systems, tended to have more of these chemicals and at higher levels. The chemicals that we're testing for are not currently regulated in drinking water, so we don't have a standard against which we can compare our results. It's important to note that the levels that we found are at the parts per trillion levels, so these are very low levels. In the case of pharmaceuticals, the amount of pharmaceuticals is much, much lower than you would get if you were actually taking a medication. And for things like flame retardants or non-stick stain-resistant additives, your exposure from drinking water is likely much lower than you would receive from actually using these products in your home. But there are still reasons why the presence of these chemicals in drinking water is worrisome. For instance, we often don't prescribe medications to pregnant women or to children because pharmaceuticals can have effects at very low levels. And we know that some people are more sensitive than others to certain chemicals, such as people who are sensitive to certain antibiotics. And we also want to do the best job that we can at protecting our drinking water now and for future generations. We're still learning about hormone-disrupting chemicals, which in some cases can have effects at lower levels that we don't actually see when we do testing at higher levels. And we're very much learning about the potential effects of mixtures of chemicals. So if you have a little bit of an antibiotic and a little bit of a flame retardant and a little bit of several other chemicals, do they interact with each other in a way to cause effects that you don't see when you study each chemical separately? So we still have a lot to learn about potential health effects, and we think that our results can inform drinking water protection measures that prevent these chemicals from getting into drinking water in the first place. Our study of breast cancer and the environment included 2,000 women who lived on the Cape, around half who had breast cancer and half who had not. And we tried to figure out what the differences between those two groups of women might be. As part of that study, we asked women where they had lived throughout their lives, and we tried to recreate what their drinking water quality might have been like in earlier decades of their life. For a disease like breast cancer, it's really important to understand chemical exposures decades back in a woman's life, because chemical exposures that can happen around puberty or even earlier may play a role in the disease. Our work did not find an association between water quality and breast cancer incidence. But there are limitations to how we were able to do our testing. We relied on historical data of nitrate. Nitrate can be a marker of wastewater impact on drinking water, and so it could be a marker of endocrine disruptors or other chemicals that might play a role in breast cancer. But it was very difficult to reconstruct people's exposures when they had a private well or when they had not lived on Cape Cod. It's also possible that nitrate is not necessarily a good marker for the specific chemicals that are hormone disruptors that might be of concern. And it's just very difficult to reconstruct chemical exposures so far back in a woman's life. So our approach now is shifted to a more forward-looking approach. And our basic approach to breast cancer prevention is to identify chemicals of concern from the perspective of breast cancer, and then to identify pathways by which people are exposed to them, and to use that information to reduce exposures as a way to reduce breast cancer risk. So our work is really focused on understanding what women are being exposed to now and thinking about ways that this water quality testing can play into decisions that are being made about future drinking water protection on the Cape.